Hi, welcome. It's Miss Dean here, one of the health teachers here at Shelton High School. And today we're going to be talking about the number one technique to manage stress, and that is your breath. And I know it sounds crazy, we breathe all the time, but actually science is showing and has shown that the breath is the number one way to manage stress, to reduce anxiety, to be more grounded, to basically have it affect your health, your organs in a very positive way. So it helps when you are anxious, if you have a lot of anxiety, it can help calm that. It lowers that heart rate, it lowers the breath, it lowers the blood pressure. It makes us able to actually see things a little clearer. It changes the chemistry of the brain almost immediately just by becoming aware of the breath. So by the first step, which is just becoming aware of the breath, brain chemistry already changes. The function of the organ changes. And then when we learn how to do diaphragmatic breathing from the belly, that adds another component that helps even more. And then we learn to slow it down. So there's three big components of the breath that we want to practice. So the first is awareness. The second is diaphragmatic breathing. And the third is slowing the breath down. And the cool thing is that you can practice this breathing technique anywhere, anytime. In fact, the more that you practice it, the more that it will be the first thing your body and mind think of when you're in a state of that fight or flight or freeze or stress and overwhelmed, or you want to punch someone, or you want to just curl up and cry. So, but it won't be that first thing you think of unless you actually practice it. You have to create a habit, just like anything. So, the majority of individuals don't breathe correctly. And I know you think that's crazy, but it's so true. We all tend to breathe correctly when we're sleeping, or sometimes when we're just on the couch relaxing and not thinking about it. But the moment we think about our breath, the majority do not breathe correctly unless they actually have a yogic background or some breathwork training or singing. So most singers who have any type of vocal training actually do breathe correctly. So just to try it out, I want everyone to take a nice deep breath in. And out. Good. Now you'll notice what I did because the majority of why we don't breathe correctly is we mirror what we see. We lift the chest, we breathe in quickly and out. And though that might feel good right now, that's not going to help. That won't help with the brain chemistry. It will, it brings some awareness to the breath, but it's not what we want. We have the breath up here in our chest, which actually increases anxiety. So we want to bring the breath down here. Now for many of you it's going to be hard, and for many of you you're not going to get it today, and that's okay. And for many of you, sitting up is not the best way to practice because you've trained so much to hold the belly in while you breathe shallow breaths up here in your chest. Okay? So the best way to practice is actually laying down. And for those of you that maybe you're like, oh, whatever, I don't need to do this for stress management, that we all do. It also helps with any sports, or if you're active, if you can really learn how to do that diaphragmatic breathing, it will increase your endurance like crazy. I've worked with so many athletes with yoga, and they say the number one component of yoga that helped them, the strengthening, the stretching, the being aware of the body is great, but it's the breath. It's the breath that has helped them in their races, the breath that has helped them in their competitions, and then has allowed them to do more things with whatever sport they're in. So, I want you to, the brain loves sensory. The brain loves like where we touch on our body. It likes to bring awareness to. Also, the brain gets very distracted by what we see. I believe it's over 90% of our senses from the brain comes from our eyesight. So when we close our eyes, we can actually tap into feeling our body a little bit more. So only if you're comfortable, you can close your eyes through this. Otherwise, try to limit the distraction of the brain. So focus your eyes. It's nice to focus it like on a point, on a wall, on the floor, and don't move it's called a drishti, but don't move your eyes from that point. It kind of helps the brain focus on one thing and not be distracted by everything around us. So, if you want, you can put a hand on your belly, but I want you first to just be aware of your breath. So just notice if your chest is moving, if your shoulders are moving, or if your belly is moving. Notice if it's quick or if it's slow. Don't try to change it yet, just notice. So like I said, science shows that simply bringing awareness to the breath starts changing the stress response. Pretty amazing. And then even more happens the more that we work with the breath. So now that you've kind of been paying attention to the breath, I want you to see if you can bring it to the belly. And I know it's going to be a little challenging because guess what? You have to relax your belly, right? You have to let your belly actually relax, and it's okay. We all have a belly of some sort, and it's just natural. So I want you to see if you can relax your belly so that your chest doesn't move when you breathe. But as you breathe in, a lot of you, your belly goes in, which is an incorrect habit that you've created, right? Which can create health issues. So we want to go back to what the body is meant to do. So as you breathe in, the belly should go out. As you breathe out, the belly draws in. So just see if you can do that. Like I said, I know for a lot of you it's going to be hard. See if as you breathe in, you can, it's not a push your hand away from you. It's not a physical thing, right? It's just allowing the breath, allowing the body to relax, allowing your belly to relax. And as you breathe out, the belly draws in. And again, you're not sucking it in, right? You're just allowing it to gently move. So the second step. First step, awareness. Second step is belly breath. Everyone thinks, yes, the lungs are part of respiration, breathing, but it's the diaphragm that we're working with here. When we breathe in, the diaphragm actually expands down and out, so the belly needs to get out of the way so it can move, your organs, etc. And as we breathe out, it comes back up. So the belly comes back in. That's why that's the natural flow of the belly. All right, so don't get frustrated if you can't do it. Just keep trying, practicing. Like I said, maybe try laying on your back. It's easier to feel your belly rise and fall when you're on your back than when you're sitting up. A lot of people, when they sit up, they try to hold it in, and it's really hard to let it go. Even adults, from kids all the way to adults, you've learned this habit, so we just want to change that. So if you haven't got it yet, it's okay. Just still go to this next step, but really try to come down into the belly. So what we're going to do now is hopefully you're working on getting the breath down into the belly. And we're going to lengthen, so we're going to slow down the breath. It's actually kind of a pet peeve of mine when doctors or anyone, yoga teachers, anyone says take a nice deep breath, because we're trained. That's a deep breath, right? So it should be more take a slow deep breath, or just take a slow breath. Okay? So I'm going to guide the counts. We're going to start with 3 counts in and 3 counts out. For a lot of you, that's going to be where you're going to be. I'm going to go to 4, and I'm going to go to 5, and then we're going to see which is more comfortable for you, okay? So go ahead and breathe out all the air. Try to keep the breath in the belly. Shoulders shouldn't come up. So you're going to go ahead and breathe in. 2, 3, and breathe out. 2, 3, and breathe in. 2, 3, and breathe out. 2, 3, and breathe in. 2, 3, and breathe out. 2, 3, and breathe in. 2, 3, and breathe out. 2, 3, and breathe in. 2, 3, and breathe out. 2, 3, now 4. Breathe in. 2, 3, 4, and breathe out. 2, 3, 4, and breathe in. 2, 3, 4, and breathe out. 2, 3, 4, and breathe in. 2, 3, 4, and breathe out. 2, 3, 4, now 5. Breathe in. 2, 3, 4, 5, and breathe out. 2, 3, 4, 5, and breathe in. Now go to whatever count to yourself. Go to whatever count is comfortable for you. I imagine most of you it's going to be 3, some of you 4. If you have a vocal background, maybe 5. Don't go past 5. Don't go past 5. And we want it fluid, so you don't want it breathing, stop, breathing, stop, breathing, stop for the count, and you don't want to hold the breath after the breath in or hold the breath after the breath out. Not for this purpose. There's reasons we hold the breath. You don't want to do that right now. So just find a nice, balanced breath in and breath out. Keeping the shoulders relaxed and down and seeing if you can come to the belly. Again, you're counting to yourself, same count in as the same count out. And just see where you're at. See if you can find it and become relaxed in it so that it's not a strain. I know the first time when you do this it can feel kind of pressured and strained to try to slow down the breath like that. Some of you might need the count of 2. Some of you might need to just count to 2 right now, and that's fine. The more that you practice this every day, the more your count will increase. So I want you to continue counting as I continue talking. One other time that this is really great to practice is when you're listening to someone talk. So once you get used to this, try doing this while paying attention to someone talking. It can be a great preventive tool for when the time comes when you're speaking with someone that's triggering you in some way. Whether you're angry at them or whether you want to cry, you feel like you can't talk to them, there's a conflict of some kind. This breathing technique can really help you stay calm and be able to actually talk rather than react and go into that fight or flight stress response. Just a little longer. And eyes, remember, closed or focused on one point. And I'll then allow the breath to go to normal. Just take a moment and notice how you feel. And just see if you feel a little different than the beginning. So again, this is something you can practice anytime, anywhere. #1 stress management tool for everyone. It can help for everyone. You just have to practice it. So this video is an introduction to it. There's going to be another one that doesn't have all the explaining, that just takes you right into it. So you can start using that one as well if you need more guidance. Otherwise, practice as often as you can. It will help with stress, it will help with anxiety, it will help with performance if you are an athletic person or you like to just move a lot. Yeah, hope you enjoyed it.